This impacted canine was completely embedded in bone and we removed it without raising a full flap. Let's learn this interesting case of impacted maxillary canine. So a CBCT was done. Here you can see a completely horizontally impacted canine that is present. It overlaps the apical surface of 2-1. So now here you can see, using a micromotor with the surgical burr, a controlled bony window was created directly over the crown of the impacted tooth. Once the small portion of crown was exposed, the tooth was sectioned into parts to reduce the resistance during removal. This is the first fragment that was carefully luxated and removed using Warwick's James elevator, ensuring minimal trauma to the surrounding tissue. Always ensure copious irrigation to be done along with the use of micromotor, as it would obviously cause the necrosis of the surrounding bone. So here you can see that we are enlarging the bony window so that it provides enough space for the tooth to be luxated and come out of the cavity. So here you can see that we are using Warwick James elevator. It is a dental instrument used for luxation of teeth and root fragments. Luxation involves applying specific mechanical forces to sever the PDL and expand the alveolar bone, loosening the tooth before forceps are used as. So this process is basically coupled with enlargement of the bony cavity so that the tooth, here you can see that the first one of the fragments of the tooth has been removed. Since we sectioned the tooth, you can see here we are now enlarging the window furthermore so that luxation can be carried out more easily. The tooth can be removed so that enough space is provided. So you can see this is the extracted tooth placed on the. So this, you can see the site of the socket. This is how the tooth was lying. This is socket and it is irrigated and curettage debridement is done. Once debrided, we place the flaps. Since no flap was raised, the surrounding mucosa is taken up and interrupted sutures were applied. So this, here we are applying the interrupted sutures. Also post-operative instructions were given to the patient. So this is the post-operative picture.